Hello, and I am Dr. Corey King from AskDrKing.com. And today we're going to be discussing why thyroid patients, when they first get on a medication, why that medication can work very, very well, and then several months, years down the road, now they're on that medication, but it's 4 times the original dosage, and it's not allowing them to feel like they did in the very beginning. The number one cause of that is typically going to be liver and gastrointestinal dysfunction. And if you've been following along with our videos or any of our blogs on our website, you may have heard me talk about this or read me talking about this, but it's the T4 to T3 conversion and the utilization. So let's say if the doctor has you on levothyroxine, which is a T4 hormone, and they give you the T4 and then all of a sudden you feel like it's a miracle drug. 6 months to 12 months down the road, maybe the weight's starting to come back on, the hair's starting to come out, the energy's going down again. Why would that happen? Well, you must take T4 and you must convert it to T3. This is called active thyroid hormone. When it's in the T4, it's only inactive. You must activate that hormone, the T3, so the hormone can then go into your cells and produce energy and run your metabolism and just make you feel well. Well, over time, your liver is going to start to get clogged up. And the best analogy for this is the lint filter in your dryer. If you do not clean your lint filter, you know what's going to happen. Your dryer just can't work properly and your clothes are going to take longer to dry, maybe multiple rounds of you turning that on button back on. So over time, your liver, it filters medications, it filters toxins, and it starts to get clogged up because your liver's job is essentially to detoxify your blood. Not only detoxify your blood, but help you methylate, so utilize your B vitamins, allowing your energy and your stamina to remain high and strong. It helps you utilize female and male hormones. It helps to clear off exogenous hormones. That is more for people like women that are on birth control. That's an exogenous hormone. Your liver starts to get accumulated. Its job is it's trying to get rid of that stuff. But you've got to detoxify your liver. So the average age of a patient that consults with me is around 43 to 45 years old. One of my first questions I ask them is, well, how many times have you flushed your liver or detoxified your liver? And a staggering number will tell me big goose egg, 0 times. Big issue. Your gastrointestinal lining helps to convert 20%. So your liver does 60, your gastrointestinal lining does 20. So combined, that's an 80%, say 80% contribution, if you will, to your utilization and your conversion of your thyroid hormone. So if you have a bad gut, let's just say you have an autoimmune condition like Hashimoto's. If you have an autoimmune condition, you have a bad gut. Not all gastrointestinal patients have a ton of symptoms. For example, celiac patients, up to 50% of them are considered silent celiac, meaning they don't have any symptoms, but yet they have one of the worst autoimmune conditions that's destroying the daggone gut lining. So between the liver and the gut, those are some of the biggest reasons why I see the medications just not working like they did in the very beginning. And then a lot of times the doctors, they just keep increasing the meds, and maybe they switch you to a different med. But you really need to look at the liver and the gastrointestinal tract. I'll put a link in the description of this video that you can go to the link and it will take you to one of my blog posts. And at the bottom of the blog post, you can download all the lab markers that we run on all of our patients. And that's 67 markers. So it includes 10 thyroid markers because you need to look at all of those markers in order to determine what's really going on. Here's another issue. If your doctors are only looking at TSH and T4 and they're neglecting T3 and free T3 and free T4, they're going to miss the boat. Meaning, if they're just managing your thyroid condition off of TSH and T4 and they never look at T3, how do they know if you need T3 support? So they can be giving you a ton of T4, but what if your body's not converting that T4 to the T3 and they just keep increasing your T4 without ever looking at your T3? And what if your T3 is what is low? Well, that is what needs to go into your cell. So they've got to run the right laboratory markers. So not only do we see issues with the liver and with the gut, but we see issues with the doctors. and the doctor's just not running a full thyroid panel in order to truly see all the different pieces to the puzzle. So to learn more, make sure to visit our website at AskDrKing.com. You can take a look at our Instagram page because we put a ton of great recipes on there each week. We also put those on our Facebook page, Ask Dr. King, as well, with a lot of videos and just blog posts. And you can check out more of our YouTube videos on Ask Dr. King as well. So make it a fantastic day. I look forward to teaching you and educating you. And if you're struggling with your health condition and your doctors just aren't helping you how they should be, then contact me because I work with patients remotely all over the country and all over the world. We'll talk with you soon.